Welcome back. Doctors need pictures, to diagnose nose and sinus problems, but we're not talking about traditional x-rays here.
That's right. Dr. Madan Kandula is here from Advent to tell us about this. It's an in-office CT scanner, and it's the only one in southeastern Wisconsin, and it's something that is a lot smaller than most people are used to when they think of a CT, right?
Yeah, it is. Yeah, so it's what it looks like. It looks like basically a kind of an elaborate chair, and it gives us the images we need, though.
And speaking of the images you need images from here to here, generally speaking.
Actually, really from here to here.
Oh, really?
So, yeah,
just right
it's
here?
Right there, exactly.
Okay, so it's very specific.
It's very. That's why it's so small. It's very specific. It's going just at that target area. You know, that's what it's designed for. It's not designed for, you know, just looking at somebody's belly or anything else. And so therefore it can be a lot smaller. Therefore it can be upright. Therefore it's something that's, you know, really neat and great for our patients.
So as we back up a little bit, in your opinion, what are the proper ways to diagnose then sinus as well as nose issues or problems?
You got to look. I mean, it's as simple as that. But if you think about it, if anybody's had, you know, sinus issues or nasal congestion issues, if they think about the last time they went to their doctor, if their doctor is not an ENT, they probably didn't really get a good look as far as what's going on in there. So there's really in the office, there's two ways we can look in the nose and the sinuses. One is with a headlight, so it's just like a miner's light, so a light on your head that you look into the nose, you can see back into the nose. That's sort of old school, but it works, and that's still the old, you know, sort of the golden standard. And then up the ladder from that is something called an endoscope, which is basically a camera that's on, it's a rod basically with a camera on the end, and we're able to look into the nose, look into the back of the nose, look into the throat with that. And that gives us much better information about what's going on in the nose, but neither of those two things lets us see into the sinuses. And lots of times, and this happens all the time, happens to me all the time, where I look into somebody's nose with either a headlight or endoscope, and I think, well, there's maybe not so much going on, but then we look behind the scenes, which is what the CAT scan does, and that tells us a different story.
Are you always looking behind the scenes, or can you sometimes diagnose the problem with just the endoscope, or do you always go that step further now?
Good question. So basically with a headlight we can see a lot. So we can see deviated septums and blockage and polyps, and if somebody has issues with infections we can see drainage. That gives us some clues about what's going on in the sinuses. So you can see a lot. With an endoscope you can see a little bit further back, but it's the same kind of concept. Sinuses, you can't, I don't care what tools you have, if it's not an x-ray, if it's not a CAT scan, nobody, not me, not you, not anybody can look into somebody's nose and tell them definitively that they have a sinus infection or not. It's a simple question. So do I have a sinus infection? Well, it's all we're going based off of the clues that we have, but if we can't see in those areas, you can't know. I mean, it's sort of a simple concept, but it's true.
So if you have the headlight, the endoscope, you still can't get a complete picture. That's really where the CT scan is so necessary and critical to diagnose, right?
Yeah, I mean, and it shows us many of the same things that the headlight and the endoscope show us, but it shows us a lot more. So it shows us into those sinuses. It shows us thousands of pictures in 3 dimensions, front to back, top to bottom, you know, side to side, so that we're not missing anything with that. So we can see the same thing if somebody's got a deviated septum, if they've got polyps and things that way. But more importantly, we can see into the sinuses and see if they've got an infection or a chronic infection, which is where that really a lot of folks have chronic infections. They have no idea that it's going on until we get a CAT scan, and then it's sort of the aha, this is the story. And I see that, you know, multiple times every single day.
Now the CT scan is called the mini CAT. I think we saw a picture of it already.
Right.
Quick and easy, advantageous to the patients who are going to be using it?
Yeah, I mean, its concept is the same, and I think most folks have heard of a CAT scan, but all of the CAT scan is a 3-dimensional picture, x-rays, looking into any area, but in our case, the sinuses. The mini CAT is a smaller version of a CAT scan, and it gives us the same information, but it's just in the office. So something that we can do seamlessly with our practice. So if somebody comes in, if they need that, not everybody needs that, but if they need it, we're able to get it done, look at those pictures together, get to the heart of what's going on for somebody, and, you know, try to figure out a solution.
We've talked before about how many people, and it's a huge number, suffer from chronic sinus problems.
Miserable.
Yeah, and for people who've never had a CT scan of their sinuses, especially for those chronic sufferers, does it give you some sort of picture that really helps so that they can get better?
Yeah, all the time. I mean, I see this, again, every single day when I'm in the office. I see folks who have been struggling for years, sometimes decades, and they've, you know, tried this nose spray and tried this and that and the other thing, and they just haven't gotten better. And, you know, we kind of go into the questioning, and they've never had even a simple x-ray, and yet alone a CAT scan. And so many times we do a CAT scan, and then again, it's the aha moment. This is what's going on. This is the problem. These are the things we can do about it, and that's a game changer.
And it's not always antibiotics.
No, it's not. I mean, unfortunately, well, for folks who are having issues with infections that aren't going away, typically antibiotics aren't going to do the trick because they haven't done the trick. And so we usually have to go up the ladder and do something to establish drainage so that those folks can get better. The only way we can figure that out, anybody can figure that out, is with a CAT scan.
It's important. It's great that it's in the office. I see that as a huge advantage for patients. And one of them is just convenience,
Yeah,
I
absolutely.
would think, which
Sure.
is huge.
Is it covered by health care?
Yep, absolutely.
Okay.
Yep.
That's good news, too. Here's the
All right,
information so you can get in touch with Advent. They are located in Wauwatosa on North Mayfair Road. The phone number to call for an appointment, maybe get a CT scan, finally, don't suffer anymore with chronic sinus problems. It's 414-771-6780, or you can go to advent.md. It's always nice to see you. Thank
Always
you
nice to
very
be here.
much.
Thank you very much.